But welcome to all those who have joined us so early this morning. We really appreciate you coming for our 2024 Policy Dialogue, Strengthening PhD Accountability for Improved Maternal and Child Health. We're really pleased to have all of you here. We're really pleased to be back in Kano as well. So for all those who don't know Nigeria Health Watch, we're a health communications advocacy organization based in Abuja, Nigeria. Our work focuses on advocacy around the main health challenges and issues around Nigeria, with primary health care being really the fulcrum of a lot of the work that we do.
Of course, a lot of progress has been made in Kano towards strengthening primary health care. Some of the giant strides that have made include the establishment of the State Primary Care Management Board about 12 years ago. Now there is an agency of government established by law that is responsible for the implementation and the entire management of primary health care in the state.
Nigeria Health Watch as an organization is not left out in this effort and this approach. And this project, which is the Global Policy and Advocacy Project, is part of our initiative to ensure that Nigeria as a whole, Kano State as a whole, and the other 35 states and the FCT have reduced maternal mortality ratio. And as part of it, we launched this survey. This survey is a community-based perception survey, which looks at critical data points from Kano State.
Your findings, also your study really answered your objectives. And then in one sentence, give me your the conclusion of this study. Thank you.
So, sir, our survey is directly linked to the objective of the survey. The objectives of the survey looked at ensuring accountability as transparency, look at ensuring community engagement and involvement, and look at reviving government structures and approaches into accessible and equitable service delivery. So they are well linked. And the conclusion of the survey, like I've said in the gaps that we have identified, is that we have limited human resources. Okay, not a lot of people have access to healthcare due to this limited human resources. The limited human resources that we now have, there is a lot of strain on the limited human resources, which is now causing these healthcare workers, the few healthcare workers that we have, is now affecting their attitude to their patients, which is now also reducing the quality of care. So it's a chain effect. And what we have realized in the chain effect is that once we're able to tackle the challenge, the first challenge we encounter, which is human resource, it will trickle down to all of these other challenges, and we can move steps further in ensuring that we achieve the objectives of our survey and, of course, the objectives of this policy dialogue as well, which is to strengthen accountability in maternal and child health care.
The hope is that in a decade, the health system will be revolutionized in the country. I hope this discussion will, at the end, will highlight our gaps, our weaknesses, especially we in Kano. I heard the DG talking about all the strengths. I want to know my weaknesses, please. Let me know my gaps, and let me see how to bridge the gaps.
You know, for us listening to some of the remarks you've made, it really reflects why we chose to come to Kano. As we all know, the many challenges we face in health are not just the purview of the state leadership. It really also requires the voices of citizens. And one of the things the Honorable Commissioner mentioned is he doesn't just want to hear what's going well, but also to hear where the gaps are. And the way you know where those gaps are listening to the voice of citizens. The community perception survey that was presented, as Solomon articulated, was the perception of people in communities. And we all know that these are the people that we are here to serve. This definitely deserves a round of applause. But also, as was mentioned, Kano also has many strong partners that are supporting in delivering this health access. And one of the things we're very encouraged about is the current administration's National Health Sector Renewal Initiative. And what that has done is through the swaps that was discussed, the one plan, one budget, one report, and one conversation, we hope now to have an alignment of all partners working in the state, aligned to the state priorities. I know historically as an organization, when we've worked across different states, we often meet multiple partners addressing different interventions, but we often look at the outcomes, and those outcomes are not getting any better. And often it's because there is a lot of fragmentation in the implementation of the projects. But with the swaps approach, the idea is, as a state, you set your priorities and partners will align. Not just partners, but also let's not forget the important role of the private sector. The private sector has a critical role to play, and during one of the panel sessions, we'll see how one of the partners is addressing that.
My take home is about the community engagement. So I found the first one, which was about the M&E that they did on communities and what they needed. So that was very impactful, and also the policy. So it was how we go from what people say, what they need, to how policies are made. So that's very important, because we keep talking about every time how changes are made, but how seeing the process of how these changes can be made is quite insightful on the impact as a community and also as society, how we know what needs to be done and how it needs to be done.
How are the insights from these community and PDSR committees and some of their meetings translated upwards to improve childbirth, essentially?
Okay, so what is happening initially, some years back, we piloted the community-based MPCDSR in 10 LGS. So now in 3 LGS, now we scale up to 10 LGS, and we are scaling up. So what we are doing is we engage the WDCs, and we also link them up with the facility. So everything that is happening at the community level will be directly linked to the facility that is nearer to that community.
I'm requesting, can we also have a grant that is community targeted, particularly 100%? Can we explore options like adopt a PSC? Because there are people down there that have resources and are willing to actually invest into health or into primary health care, but they are not aware.
Thank you so much. This is the first time someone has earnestly given us such a specific call to action after one of these dialogues. And you're right, governments can't do it alone. So we are committed to continue our work in Kano, and we'll work very closely with your department to do that. And thank you all so much.